My name is Dr. David Benversi, and I'd like to share with you some of the most effective ways I found to help out with whiplash and the symptoms that it presents with. In our office, there are three main treatments that we would use for whiplash, and by themselves these treatments are very effective, but when we use all three of those treatments together, it is extremely effective. And those three treatments are the chiropractic adjustment, electrical muscle stim, and also traction. The chiropractic adjustment helps out in three very important ways. The first way being that it helps reduce the pinching of the spinal or the nerve that's coming out of those areas. The second way is that it reduces the problems associated with the disc in those areas. And lastly, it'll be helping out with the joints in those areas. Now, with the regards to the nerve in those areas, when we're applying the chiropractic adjustment, the space and availability for those nerves to function much better is increased dramatically, and that allows the pain levels to reduce or drop down dramatically as well with the chiropractic adjustment. With regards to the joint, when those joints or those bones are being pushed together, there's very sensitive areas in between those joints, or the joints are actually called facet joints, and when we provide the chiropractic adjustment, we relieve that pressure or tension between those two joints, and that's going to reduce the amount of pain in those areas as well. And lastly, when we're talking about the disc in those areas, we have the disc, which is in between each set of bones in the spinal column, and when we're applying the chiropractic adjustment to those areas, those discs are going to be able to move and function much better than what they were before and without the treatment. Now, moving on to the electrical muscle stimulation, basically what we do with the electrical muscle stimulation is we provide, or we apply a couple pads to the area of the treatment that needs, or the area that needs to be treated, and it'll apply a mild electrical current through that area or that part of your back. And what that does is three main things. It will decrease the pain, it will decrease the inflammation, and it's also going to increase or decrease the muscle spasm or tightness in that area as well. Now, with regard to the decrease in the pain in that area, when we're applying that electrical current, it basically acts as a nerve block, or it stops the pain signals from that area to being sent out, so you're not feeling as much pain in that area. The next thing with regards to the reduction in the inflammation is when we're providing that electrical stimulation to that area, it's pulsating through that area, so it basically has a mechanical effect, so it's going to effectively reduce the amount of inflammation and help clear some of that inflammation out of that area, which is one of the main contributing factors for pain in that area, is the inflammation. And lastly, it's going to reduce the muscle tension or muscle spasm in that area, which again, when we have that mild electrical stimulation going through that area, it's going to help those muscles to relax and help that area to recover faster. And then with regard to our last treatment, the traction, when we're looking at the traction, we're looking at two main areas that it's going to help out with. One is it's going to help out with the disc in that area, and the second one is it's going to help out with the joints in that area. When we're applying that traction for the discs in that area, what we're going to be doing is creating more disc for those, or more area for those discs to be able to function and do what they need to properly. When we're looking at the joints themselves, again, when those bones are on top of each other and they're being pushed together or pressured together, they're very sensitive, so any type of increase in pressure is going to cause pain in those areas. So when we provide that traction to pull those areas apart, it's going to effectively reduce the amount of pain that we're experiencing in that area as well. Now, with the patients that we've treated in our office, a lot of them say that they have a reduction in the amount of pain that they're experiencing. They'll note that there's an increase in range of motion in those areas, and they're also going to tell us about a lot how they have a reduction in the muscle spasm in those areas as well. Now, when we can reduce those three things, there's some very important things that they're able to do in their life that they haven't been able to do effectively up to that point. And a couple of those are being able to go to work and function at work and do the things that they need to perform at their peak level at work, or even to be able to go to work at all. The next thing would be to be able to perform their activities of daily living, which include things like bathing and hygiene, such as being able to wash their hair, getting in and out of the bathtub, and being able to dress themselves or tie their shoes, something simple like that, that they might have not been able to do beforehand. And lastly, a lot of times our patients are telling us about how they're able to sleep better at night. Not only able to fall asleep better, they're staying asleep longer, and they're feeling more rested and more ready for the day after they're done sleeping because they feel so rested. So if you're in pain, we'd love to help. Please give our office a call at 618-519-9334.